Goodness gracious. Now I'd like to invite to stage the commitment makers of the Ebola call to action, and I think you'll see why I'm not calling them all out as they file in. There will be almost as many people on the stage as there are in the audience. You laugh, but you'll see what I mean in a moment. As many of you know who were at the 2014 CGI meeting, we announced a call to action to galvanize more support to help the countries who were affected by Ebola, Sierra Leone, Guinea, and Liberia, and to focus on both emergency relief and on building more resilient health systems. Building on the first 4 commitments that were announced last year, we have 12 new commitments to announce this year, and I'm going to go through them one by one, and maybe the people who are involved in each can, I don't know, raise your hands so that you can be sufficiently identified with your specific commitments. The Aspen Institute, in partnership with Partners in Health, GlaxoSmithKline, MDG Health Alliance, and USAID, will provide management, financial, and strategic expertise to ministries of health across 6 nations for a period of 3 years. In addition to establishing mentor networks and cross-country convenings, the partners will recruit, train, and deploy in-country management professionals to work side by side with ministries of health on high-priority community health projects, ultimately to help strengthen health systems. To support Ebola survivor services in Sierra Leone's Bambali district, Director Relief is committing to establish a community health clinic that will accept all Ebola survivors from Bambali and its surrounding districts to provide ongoing supportive care. Established in partnership with Medical Research Center, this clinic will include outpatient and observation wards staffed through Sierra Leone's Ministry of Health and Sanitation, provide referrals to specialized health services, offer mental health and psychosocial services, eye health care, and more. Management Sciences for Health, in partnership with Save the Children and the International Medical Corps, is committing to establish the No More Epidemics campaign, which will coordinate and advocate for the development of health systems that can prevent major epidemics in the future. Working across Liberia, Sierra Leone, and Guinea, No More Epidemics will launch a website and social media platform and develop a community scorecard such that communities will be able to evaluate their own preparedness and hold their local leaders accountable. Resolve, along with its partners Chevron Corporation, Cordaid, GIZ, the German Development Agency, and Jeffrey Wright, is committing to support sustainable economic development in the Ebola-affected countries in West Africa by launching a marketplace that profiles investment projects in small and medium-sized enterprises and helps connect them with donors, investors, and other partners. The platform will help support the partners in their own recovery by restoring their local supply chains, helping diversify their investment base, and ultimately revive their stalled projects. The World Bank, in collaboration with its Africa United partners, the Confederation of African Football, the US CDC, the CDC Foundation, the African Union, the Ministry of Health of Senegal, and the National Institutes of Health, is committing to scale up its Ebola communications platform, Africa United, to include other leading health issues across Africa. Partners will recruit celebrities, footballers, NGOs, governments, and corporate partners to build a brand that they hope will be a go-to communications resource to facilitate behavior change, advocacy, and when needed, crisis communications for 11 million people in Guinea, Liberia, Sierra Leone, and eventually an additional 30 countries. Aside from new commitments, CGI members are also reporting progress on ongoing commitments, many of which have, by necessity, had to be agile in adjusting mid-course to rapidly respond to the evolving Ebola crisis. SESSA accelerated the deployment of a customized SatMed e-health platform and an antenna to Sierra Leone, which enabled stable internet connections for communication, data collection, and e-learning throughout the Ebola crisis. The Abundance Foundation expanded its health system strengthening and medical education commitment to Sierra Leone, establishing an Ebola research center to study the efficacy of a point-of-care Ebola diagnostic instrument and develop handheld data collection tools for community health workers. Now, normally I know we just give a round of applause, but given how extraordinary all this is, can I ask all of you to stand up and please applaud our remarkable commitment makers? Thank you very much.